Fox 5 News starts now.
Utah's largest hospital system wants to help build the first freestanding children's hospital in southern Nevada.
A new study released by UNLV is hoping to create renewed interest in a private-public partnership that could make that happen within 5 years. Fox 5's Alexis Fernandez has details on the proposed plan.
Well, John and Kim, southern Nevada is the largest metropolitan region in the country without a standalone children's hospital. With the state's growing population and shortage of nearly 200 pediatricians, advocates say a children's hospital is needed. Intermountain Health, which already operates a children's hospital in Salt Lake City, has shown interest in partnering on a children's hospital project. According to a new study released by UNLV's Lincy Institute, the 150-bed hospital would cost $1 billion to build and create nearly 12,000 jobs. The study suggests the best site for the proposed hospital would be at the Harry Reid Technology Center at UNLV. A spokesperson with Intermountain Health said it agrees with the report and is looking to improve children's health care in the valley. Here is what the region president said back in June.
There are more children than we have pediatricians to provide the care and primary care services. So we're focused really hard there. We're talking with pediatricians, we're collaborating with pediatricians because we also know that there are certain pediatric medical and surgical subspecialists that aren't here.
And according to the study, it could take up to 5 years to build a children's hospital. Intermountain Health said no decisions have been finalized.